I had the privilege to present the data of our survey. So we were interested what is the oncological community thinking about the medium and long-term outcome of COVID. And a first question was, of course, what is about the impact concerning the treatment? So our survey was constructed by 20 oncologists from 10 of the most affected countries in the world when the pandemic started. And we sent out this survey to 18 different countries, and we had 109 answers to our survey, and these answers were all based on invitation to our survey. So the first thing, what are the most effective treatment modalities? And we will define as an effective treatment modality if in a particular center at least 10% of the patients had either a cancellation or major delay of this treatment modality. And we have seen the most affected was surgery, with 34% of the centers that reported surgery was affected, followed by chemotherapy, over 20% of the centers, and then radiotherapy, still over 10% of the centers. What we also learned is that in 32% of the centers, we stopped earlier an active palliative anti-cancer therapy, and most importantly, 64% of the participants are concerned about the risk of undertreatment. So this means that the patients have fear about COVID and may decline to receive an indicated adjuvant treatment or a treatment for early metastatic setting, where really with the treatment we have a major impact on disease. Concerning now other aspects, we looked also to the use of teleconsultation, and as expected, almost all the participants used, at least in some patients, teleconsultation, almost everyone for long-term follow-up and for targeted oral agents, but also more than half of the participants use teleconsultation for patients who receive chemotherapy or immunotherapy, and over 80% indicated they expect to use more frequently also teleconsultation in the future. We looked also to the role of virtual meetings, and almost all of us use more frequently as expected these virtual meetings for team meetings, for continued medical education. But interestingly, for 45% of us, we estimate that this is not a very good alternative to live meetings for international meetings as ESMO or ASCO, because what we like there also is not only to see the presentation, but also to have the interaction between the participants. And this is really what is lacking when you have only these virtual meetings. We looked also to the well-being of the participants, and only 18% estimate that at the end of the year they will not be back to the same well-being than before the crisis. And also there is an easy access to psychological support. Only a minority, about 10%, will use or have used psychological support. Now, looking to the future, we have two major concerns about the risk. On one hand, we have seen everywhere in the world that because of the pandemic, there are much less new cases that are diagnosed. And of course, cancer is not disappearing. So this means that actually the patients don't come to the centers, and that we are not doing the diagnosis. And with time, the risk is, of course, that there will be a migration of the stage, and we will have much more advanced disease stages. And then the second long-term impact may be the financial impact. At this time, we are not yet seeing this so much, but we expect that because of the pandemic, that there will be financial problems in the next years, and for many of our patients, maybe unfortunately, this will lead to the absence of access to good health care. So these are really our long-term concerns from this survey. This is what we start now to see. So our activities going up again. We see more new cases. And we are now a little bit afraid what could happen if there is really a second wave, because the first time we blocked the whole hospital for the first wave, and except in oncology, only emergency treatment were performed. But now it will not be possible the second time to block all the country, to block the healthcare system totally. And now we have to treat the COVID patient in addition to the other patients, but we cannot stop to treat everything else. Now, the real impact we don't know. If now really the patients come back, probably a few months of delay in diagnosis will not have a huge impact, but we really hope is that there will not be any more important second wave, and that patients continue to stay away from the hospital. At least a significant percentage will have a long delay in their diagnosis.